Welcome to Nasogastric TV.
Hip, hip, hip.
Hooray!
I'm here with my brother
Minta
Justice. Today we are going to learn on how to feed patients on an NG2. So we are going to do NG2 feeding. So Mr. Minta is going to take us through. Stick and stay with us and let's learn together. Come on, guys.
Guys, we're going to do NG2 feeding, and before we start, we need to establish rapport with the patient. So we'll first talk to our patient and ask permission from our patient if we can start with our feeding. So I'll talk to my patient by asking my patient, Papa, I know you want to say, you did say, I'm but your time I so say, I'm paying do a journey every month. And I'll power journey a cocoa. Said the no down, and before tube, and I had the amount. It's in Pacho, who called one and a journey no about. Now, guys, we can't start by feeding when the patient is lying down. So we need to elevate the head of the bed to 90 degrees before we can start feeding. So we protect our patient with a leaf. Okay, guys, we have our trolley here. What it needs to be on it. We have our prepared formula, which is the liquid food our patient will be taking. And this morning, she's taking 300 mils. We have our water here. Then we need a stethoscope to check for right placement of the tube. Then we have our syringes for the feed. Then we have our input and output chart as well as the nurse's note. Before we can start the feeding, I would have to check the right placement of the tube. And in doing it, we have two ways. First, you aspirate, and second, you listen to the sound. So I'll demonstrate as it is. We would have to aspirate abdominal content for a typical gastric juice. So in doing it, we open the spigot and aspirate about 10 to 30 minutes. To be sure of what you are doing, there have to be a greasy green color so that you know that the tube is in the abdominal content. Then second method of doing it is by listening to the line sounds of the patient. And in doing it, you still need to pinch the tube so that air will not enter into the patient's stomach. And before I close the spigot, as you can see, my hand is still pinching it. So the second method is by aspirating air into it, then you listen to the patient's sound to know if the tube is in the stomach. And in opening the spigot, as I said earlier on, you still need to pinch your tube before you open it. So as you are inflating the air, you listen to the patient's gland sound through the epigastric region. And you need to hear a wheezing sound to be sure that the tube hasn't dislodged. There was a wheezing sound. Before we start feeding our patient, we have to test for the temperature of the feed. After checking for the temperature, we have to wash our hands. Then put on our gloves nicely. When we start feeding, we have to pour 10 to 20 ml of water into the tube. And as has been explained earlier on, you have to pinch the tube to open the spigot. Then you pour 10 to 20 ml of water. With the help of gravity, pour it slowly. When you are done, you pinch it before you remove the syringe. Then you close the spigot. We are now ready to feed our patient. And our prepared formula was 500 ml of cocoa. So we pinch our tube, then we open the spigot, then we insert our syringe. Our prepared feed is 500 ml of cocoa. We now release it slowly, as has been explained, with the help of gravity. The food goes slowly to the patient's stomach. And when you are feeding, do not make sure all the contents in the tube don't finish before you add more food to it. You raise your tube high. As you are feeding your patient, be looking at your patient to see if your patient is feeling uncomfortable. And when you are done feeding, we now have to give our patient water. In NG2 feeding, everything is calculated. Earlier on, we gave 30 ml of water to our patient. So we give 20 ml, making 50 ml. Still with our pinch hand to prevent air from entering the patient's stomach. As soon as we are done giving our patient water, we pinch the tube by removing the syringe, making sure air does not go to the patient's stomach. we now close our spigot. As we are done feeding our patient, it's now time to thank our patient for her cooperation. Mama, as I said, wakame hona metimi ede wanopa aduane no ama na mama waduane me ma wo enda hono mo flat and yes in the sitting up position for about 30 minutes so as to prevent aspiration of the food content. So I remove my bib, then thank my patients as explained earlier on, or as said earlier on. I now have to go and discard my trolley, wash my hands, and then document in the input and output chart, as well as the nurse's notes. So guys, we are done with our NG2 feeding. Thank you.
So guys, keep on watching Kevin TV and watch out for the next episode. Thank you.